A commonly used over-the-counter solution that is both odorless and colorless, hydrogen peroxide and its ingestion is associated with caustic injury and gaseous oxygen production that may cause hepatic portovenous gas and air embolism. Air embolism may lead to mesenteric ischemia, CNS infarction, and even death, with mortality rates reaching 75 to 90%. Here, I present a case report of a 38-year-old male who was admitted for burning periumbilical pain after accidentally ingesting about 250 cc's of wood bleach with a concentration of 30% hydrogen peroxide in the erroneous belief that this was water. Upon presentation, vitals were normal. Patient was neurologically intact. An abdominal exam was notable only for tenderness to palpation at the midline under the umbilicus without rebound or guarding. CBC and CMP were within normal limits except for a bicarb of 19 and AST of 47. Initial CT scan in Figure 1 demonstrated left hepatic portovenous gas. He was given a 1-liter bolus of normal saline, carafate, and famotidine before undergoing EGD evaluation performed the same day of admission. As seen in Figure 2, EGD demonstrated diffuse moderate gastritis. Patient was started on a PPI and clear liquid diet that was soon advanced to a regular diet. As seen in Figure 3, repeat CT abdomen pelvis the following day reviewed complete resolution of left hepatic portovenous gas. He was discharged home in stable condition with an 8-week course of PPI. As our patient demonstrates, substantial ingestion of highly concentrated 30% hydrogen peroxide leading to hepatic portovenous gas is generally benign. Indeed, most cases of hydrogen peroxide ingestion causing hepatic portovenous gas often resolve on repeat CT scan after several days of conservative treatment. Why, then, is a hydrogen peroxide ingestion and hepatic portovenous gas historically associated with such high mortality? Hydrogen peroxide ingestion causes damage through 3 mechanisms: corrosive injury, cytotoxicity via lipid peroxidation, and oxygen gas formation. As hydrogen peroxide is degraded via catalase in erythrocytes and hepatocytes into water and oxygen, 1 cc of 35% hydrogen peroxide rapidly releases approximately 100 cc's of oxygen. Such rapid production of oxygen in closed body cavities may result in mechanical distension and even perforation. However, mortality associated with hydrogen peroxide ingestion tends to involve the formation of arterial air embolism when the amount of oxygen surpasses its maximum solubility in the blood. Air embolisms may cause mesenteric ischemia and CNS infarction with ensuing encephalopathy, seizures, and even death. On the other hand, hepatic portovenous gas is the abnormal presence of gas in the portal system. Whereas hepatic portovenous gas was previously regarded as a poor prognostic indicator with a high mortality rate of 75% due to its associations with ischemic bowel, recent estimations of mortality rates have declined to 39% due to early diagnosis and the advent of CT scans empowering recognition of more benign or incidental causes of hepatic portovenous gas. Knowing that increasing cases of hepatic portovenous gas are benign, how do we manage hepatic peroxide ingestion with development of hepatic portovenous gas? To our knowledge, guidance regarding management in this area relies entirely on case reports and 1 retrospective review. Management generally involves close observation, supportive care, upper endoscopic evaluation to evaluate the extent and depth of injury, and CT or MRI imaging to assess for formation of air embolism. Hyperbaric oxygen therapy is also indicated in the presence of neurological symptoms given the danger of cerebral emboli. However, the role of hyperbaric oxygen therapy in the presence of hepatic portovenous gas without neurological symptoms is unclear. After excluding serious intra-abdominal pathology, such as intestinal perforation or necrosis that may require emergency surgical intervention. Hepatic portovenous gas following hydrogen peroxide ingestion may be treated conservatively in a clinically stable patient without neurological symptoms with subsequent resolution of hepatic portovenous gas.